Certainly I don't grow the herbs. The herbs that you get from me, if you're my patient, are not growing in my backyard. Thank goodness for that, because I'm not a very good gardener. I think I'm very grateful for knowing about Chinese medicine and being able to have it. And like, I rely on it so much that now that I don't practice every day of the week, I keep herbs at home, like a lot of herbs at home, just in case something happens to me, because like I couldn't bear to be without my herbs for like more than a day or 2 days. Hi, I'm Marie Hopkinson. Welcome back to the Chinese Medicine Podcast, the channel where you can come to learn about Chinese medicine and have it fun and easily explained to you, or have it easily explained to you in a fun way, something like that. Anyway, I'm a herbalist and an acupuncturist, and on this channel we talk about all things Chinese medicine, and I'm doing a series which is a bit more of a personal one this year in 2021. I decided that I would make 20 videos to celebrate my 20 years of Chinese medicine practice. So I've been an acupuncturist and a herbalist for all that time. I graduated in the year 2000, and this is 2021, and then I went to China in 2001, and I started my business like straight after that. So yeah, I've been in practice for more than 20 years, and this is the 20th year, and it's been a great journey of life. It's been my only life, in a way. Like, I've always known about Chinese medicine. So I guess I want to talk about in this video what I've noticed about how Chinese medicine has helped, given that you've known it for so long, and the things that you kind of experience as a practitioner. One of the most common questions I get asked is, do you use acupuncture on yourself, Marie? Or do you use herbs on yourself? Both of those questions, right? Do you take the herbs yourself? I had a patient ask me that last week. And I said, yeah, of course I do. Now, I'm brutally honest on this channel, as most people know. I just say what I feel and what I think. And this episode is a little bit of that. It's just me talking about my experience and things like that. So as a practitioner, what's one thing that's really different about Chinese medicine to other systems of medicine is you are encouraged to kind of use it on yourself. Like, there's an idea that, like, herbalists, when they first would have practiced, and I'm sure this was like this with Western medicine as well, when you were sort of discovering what things were, you would have to try it on yourself. And most herbalists were farmers, right? So that's the old term of herbalist in the Han Dynasty, was associated with a farmer. Like, you were called a farmer, because where are you going to get those herbs from? There wasn't like factories where you could go to get herbs. You were growing all the herbs yourself. And if you've ever watched those old kung fu movies, like, especially I really like those old Jet Li movies, Once Upon a Time in China or something like that, where he's like, you know, he's the disciple or the Sifu or whatever, like, you know, the Sifu and the disciple are pictured there, and showing often these kung fu schools where they had herbal medicine incorporated into it. Often what those disciples would be doing is preparing the herbal medicine. So the powder, which is like, let's say the herbs are grown and then they have to be dried and processed, like something has to be done to them, right? Or ground up, or herbal formulas made and poultices made and all that kind of stuff. Like, most of the time nowadays, practitioners don't do that. Certainly I don't grow the herbs. The herbs that you get from me, if you're my patient, are not growing in my backyard. Thank goodness for that, because I'm not a very good gardener. But I do have a lot of control in what how I produce the formulas, let's say, right? So let's say here are some herbs here in the background. These are real. Here's a nice one. This is called By Her. And so I could grind this into a powder and make it into something. You could have this dispensed as a raw herb like this. You could have granules of this made. You could have pills and powders and things like that. They're just, you know, in different ways. Now, some practitioners are really, really into being like the processing and all that sort of stuff themselves, and they really get into that. And other practitioners don't really care that much, or they just don't feel the need to get involved. I'm not saying they don't care about your medicine, but they either have a good company that they rely on, and I do that in lots of ways as well, or they just dispense things that they don't necessarily really care that much about. They just like, well, this has always worked this way, and why would I try something else? Because it's worked, right? And so I'm not just saying this to have a go at any different things. I'm just saying if you're watching this, you might have experienced lots of different styles of Chinese medicine, right? Some practitioners are really involved in giving you all these different things, and some practitioners are like, we'll just take these pills and that's all good. And again, different conditions need different things as well. Like need different, not just the formula, but how the herbs are made, how they're dispensed, right? And so as a person that's always used Chinese medicine, like always been around Chinese medicine, known about it, let's say. When I say always, I mean since I was like 18, right? That's when I started learning it, straight out of high school. And like when I first started practicing it as a student, on yourself, you'd get a cold or a flu or something would happen. And I would be like, you know, trying to practice the acupuncture on myself and seeing it like every minute of every day if you were really sick, right? What's happening? Like, oh, this point isn't working. I must have chosen the wrong point. Oh, I'll do another one. Or, you know, I'm sure a lot of students watching this might have that same experience, right? And same as with herbs, right? You take them and you really, you can feel what's happening to yourself. It's different to giving them to a patient because you're your own doctor and you're your own patient as well. You're sort of experiencing what's happening. Are my symptoms getting better? Does it just need time for this formula to work? And when you're young, you just don't know. Like when you're a young practitioner or you're a young person, and I was both of those things, you don't know. The answer to the question that my patients often ask me of, do you use the herbs yourself or do you do acupuncture on yourself? Yes, I do. I do it myself. Now, one reason I do it on myself is because I think you should be able to have the skill within Chinese medicine. It should give you the skill to treat yourself. And secondly, you should it should be a good experience to try these things on yourself, right? As in, sometimes it's not such a great experience to take some herbs that cause you to have really bad diarrhea or cause you to vomit or cause something else. But you should have that experience so you know that when you give that to your patients, maybe that's what they should expect, or at least that's what that flavour of herbs could do, let's say, right? And so that's one of the reasons. Now, I don't enjoy getting sick. No, I don't think anyone does, right? But I kind of enjoy the idea of testing out herbs on yourself, right? And seeing, like, I've certainly enjoyed coming through the other side of being sick. Now, when I say being sick, I mean, like, let's say cold and flu kind of sick, because you can kind of see the benefit of what the acupuncture or what the herbs can do. Now, particularly for me, when I'm sick with cold or flu things, I typically don't use acupuncture. I'll usually use herbs. When I wasn't that skilled at herbs, I used to try acupuncture first. If I get pain, I would usually not use herbs unless, I can't stop because I'm so busy, and I'll use acupuncture right first. Now, do you have to lie down and experience the relaxation of the acupuncture and lie down on the table and have it? No, probably not. Not as a practitioner. You typically do points where you don't need to kind of do that. Well, that's what I do. I know practitioners that like refuse to treat themselves and they're like, no, I have to go to another acupuncturist and have the treatment. You can do that as well. And that's nice to kind of do that, but my lifestyle doesn't involve like allowing the time to do that sometimes. And what I'm getting at is there's things that acupuncture and herbs can do that you only notice as a practitioner because you get to see things and you get to treat things so early on, so quickly. Now, I have patients that might call me in the morning and say, hey Marie, my neck's sore, could I come in today? Like they've literally had their neck, what's called a wry neck, like twisted to one side, and they can hardly move. And if I can see them that day, the type of treatment we would give you is quite different to if it's been going on for 3 or 4 days. And the prognosis is different. Like the prognosis, which means the likelihood of it getting better, or the what's going to happen, the progression of the disease, and how much treatment you're going to need, and how better you're going to get. All that kind of stuff is entailed in that prognosis. Is a lot more favourable, which means it's a lot better if you treat it earlier than if you leave it. Especially with something very stubborn, like you wake up and you've got torticollis, which is the wry neck, like your neck stuck to one side. Because it's acute, it's just happened. There's a lot more that acupuncture can kind of do quickly for that kind of stuff to resolve it. And, that swifter treatment is kind of recommended for those kinds of conditions. But I understand that, look, we live in a busy world and I don't open my clinic every day, and I certainly am not open 24 hours a day. And these days I only practice in my clinic like 4 days a week, not 7 days a week. And so sometimes patients can't come in on that day, and certainly things might change, within 3 to 4 days. Now, it just depends on what kind of access you have to your practitioner as to how like quickly you can get this treatment for these acute conditions. But it all starts with you knowing that there is that option there, and that the quicker you call your practitioner to get an appointment, the quicker they could probably get you in. And if you tell them over the phone, hey, this is what's going on, they may be able to squeeze you in on that day if they're a busy practitioner. You know, I know people like my teacher, he was always booked out 6 weeks in advance. And so there wasn't really much room in his practice to treat these kinds of acute conditions. Now, I would see people like that. There was these regular patients that had like an emergency. But in a general sense, some people's practice are not really same day appointment type of things. They're much more chronic conditions. They're much more things that people plan for, like practitioners that treat fertility, for instance. And they see a lot of patients that just in those areas. It's very different to acute pain and acute care. And when I had my practice open 6 days a week, I used to always treat lots of acute patients because people knew they could call me up on the day and probably get an appointment. I would squeeze them in. And, you know, I still make room for those kinds of patients now. But what I'm getting at is, do you use acupuncture on yourself? Do you use herbs on yourself? Yes, I do. And what you get to experience is, you know, the quickness of how effective things can be, and also how quickly your symptoms change and how quickly the formulas sometimes need to change as well. So, you know, that would be the answer to that question. In my experience of using acupuncture and herbs, yeah, I mean, I haven't I'm a big believer in keeping your health information private. So this isn't like a you know, a video about my health conditions and things like that. But I think there's definitely a lot to be said for things in Chinese medicine that you let go. You don't treat them early on, and you let them go, as in you let them continue on, versus things that you treat early and then they resolve with herbs or acupuncture. And like, there's always things that, you know, like I don't take herbs every day, let's say, because you know, you forget to take them, just like my patients probably forget to take them, or like, but when I'm really sick, like if I've got a cold or a flu, I'll be on the, you know, the boiling up herbs or whatever, vigilantly, like living on those things, like, you know, never forgetting to take it because the symptoms are kind of really acutely there. And then there's other ways that you just kind of remind yourself to take them. But usually I will take herbs, because partly because when you're on a formula that works for you, you feel good on it, and you know your life just feels better and better. And if you can maintain, you know, those things and you feel better on it, of course you want to keep kind of taking it. Can you acupuncture yourself is a question I get a lot. Like, can you actually physically do the acupuncture on yourself? So yes, you can, and no, you can't. It depends on what points you want to use, right? So I've had a bad back from time to time, and that's something that, you know, like, as you know, just get back pain or sciatic pain or something like that. And if we do a method of acupuncture called like balance method or mirroring method or Dr. Tan or whatever you want to call it, similar kinds of things, where you're basically using points on your hands or your feet, yeah, okay, you can easily do those points. But if you wanted to needle into your back, I have tried it. But it's not as easy to kind of do on yourself as having someone do it on you. And sometimes, like, because I'm just give it a go kind of person, sometimes I've tried to needle my back and then made my back worse because you're kind of twisting and you can't get in there and do it properly. So you can do that. Cupping, I've learned how to do that on myself. It's very easy to learn how to do cupping on yourself. You just have to be very quick with the fire and don't set your hair on fire. I've got long hair, but I've got it up today. So that would be the tip I would give any students about that. So yeah, that's answering that question. Look, this is just an easy, quick video. So I think I'm very grateful for knowing about Chinese medicine and being able to have it. And like, I rely on it so much that, like, now that I don't practice every day of the week, I keep herbs at home, like a lot of herbs at home, just in case something happens to me, because like I couldn't bear to be without my herbs for like more than a day or 2 days, because like if you just kind of use them so much, like as in if something happens, you want to get onto it with herbs straight away, as in if you get colds and flus and those kinds of symptoms, right? Now, not to say that it just resolves it straight away. Like, you know, I've had colds and flus where it's lasted like 3 weeks and it's been really, you felt really unwell. Like it might have progressed and things have changed, but you can feel that the herbs are doing something. But your body is actually still needing to fight what's going on as well. You know, so it's not like a magic, even a herbalist, that's what I'm saying, even someone who's got access to herbs and stuff, or, you know, unlimited amount of herbs, let's say, almost unlimited, you still need time for your body to repair. You still need to give your body time for some things. Like it just doesn't just like instantly kind of. So I hope this video series is interesting and useful to you in some way. People just want to know a little bit of info about me. But yeah, if I could say anything about like learning Chinese medicine, it's such a great tool to have to help yourself and to help your family and your friends and to help people that, you know, to help your community. It's supposed to be a medicine for you and then for your community and then for your, you know, for the greater good of humanity. And so that's what it's about. It's about being able to help yourself and being able to help others. And I really appreciate that knowledge, you know, of being able to do that. And, you know, it's awesome. So I'll see you again on the next video. Thank you for watching. We're going to talk about Chinese medicine because it's the Chinese medicine. Oh, fuck. God, shit. It's going to break it all down. We're going to talk about Chinese medicine. I'm going to make sure my microphone doesn't rustle like it normally does by closing my jacket. Trying something different for a change. You'll need to give your body time for some things. Like it just doesn't just like instantly kind of, you know. It's so cold today in Perth. My hands wouldn't click on time. Yeah, so you still need to give yourself time to heal.